you know, here we go. Good afternoon, all. Just waiting for a few more people to join us before we kick off. It's 3 o'clock, but I guess what's happening is that people are in their classrooms or exiting from their classrooms. Just because I think we've got around about 30 people that will be joining us, I wonder if it's a good idea that our mics are muted and our cameras off. Goodness knows how much bandwidth Suffolk has today. And for those of you who have colleagues joining, or if you're joining later, or if you're sort of busily taking notes, you'll note that the whole sort of launch is going to be recorded, and you'll get a copy of that. So feel free to sit back, pull up a footstool with a cup of tea and just listen. We have thought about perhaps how to run this in a way that is simpler for everybody or easier for people to access. So if people do have comments or questions that they want to add into the chat bar, we'll pick that up at the end of the session and publish and email that out to everybody that's attended, and publish kind of responses where there are questions. Trying to see how many we've got. If I give it another minute, then I'll get us started. For those of you also interested in Ofsted, it might be worth you knowing that we had Ofsted in on their interim visits on Monday. So if there are any colleagues in the room who would like to receive our debrief of that, please feel free to make contact, and we can give you a summary of what was asked and how that and what we thought that looked like. Okay, it's 15:02, so I'm going to make a start, and I'm expecting that we will have partners and colleagues that come into the room as we go along. But as I said, we are recording, so those people will be able to access what's shared, as will anyone else at any point. First of all, really a huge welcome to all of you, and thank you very, very much for joining us in what we think is an important, life-changing conversation around how we support children with medical needs in Suffolk. I'm Angela Ransby. I'm the CEO of the Radwell Trust, for whatever that means. I am also a passionate advocate for children with medical needs, and I don't believe in there being any heroes. I believe that the way that we support children with medical needs is where we work together openly, embracing each other's skills and putting those skills into immediate action for children. Before the Radwell Trust, I had the deep honour of working for the Oxfordshire Hospital School, and in that role, the Medical Needs in Schools was born in a coffee shop.
Interventions, really, where they went off and did little interventions in there, and they did all their social and emotional.
Oh, I wonder, we've got somebody's. You can mute. Excellent, thank you. So in a coffee shop in the John Radcliffe Hospital, I was sat with a colleague who is also in this room, talking about how it is that education and health can work together to immediately support and share knowledge to allow kids with medical needs to keep up, not catch up, to continue to be engaged in their learning, and to have the very best of what we can offer. Medical Needs in Schools was born. It was embryonic at that stage, and it's developed since then. We couldn't be more delighted at the Radwell Trust to be the coordinators of a link to the Medical Needs in Schools programme, and to feed on the intelligence and contribute to the extraordinary work that's going on in Oxfordshire, and to be part of generating that conversation in Suffolk linking Suffolk colleagues with national partners in hospital, medical, inpatient, outpatient education, which is, for those of you who are not aware of it, a fairly hidden sector, but a sector where there is tremendous creativity and joy. So thank you very, very much for joining us. As I said, if you have comments or questions that you want to make at any point in the launch, if you can pop that into the chat bar, we'll publish those at the end. And if we could keep our mics and cameras on mute, that would be wonderful. Thank you very much.
Hello everyone, we're now going to go over to Steve Lowe and Helen Griffiths, who are going to give us an introduction to medical needs in schools in Oxford.
Thanks, Laura. I'm going to attempt to share my screen and kick us off, if I can do that. I'm hoping everybody can now see that. Do somebody let me know if you can't see the PowerPoint. So I'm Helen Griffiths. I'm a clinical psychologist based in the Oxford Children's Hospital, where the Medical Needs in Schools project all began. I'm going to briefly outline to you a little bit of the history of the project, and then I'm going to hand over to Steve to tell you a little bit more about what we're doing currently. So the Medical Needs in Schools project, as Angela said, was born in Pret in the Children's Hospital from some discussions about how do we better work together to support children with medical conditions across the whole domain of education, health and psychological well-being. The team has grown somewhat over the last 3 years and currently consists of myself, Steve Lowe, James Shryan, Daniel Lawrence and Emma Johnson, and together we work together from health and education on the Medical Needs in Schools project. So what was the reason behind the project being set up? I suppose Angela and I spent quite some time thinking about what's the impact of working so separately on the holistic care of children with medical needs. Funding and services are often very separate, and we're all so busy and struggling with limited resources and time, and that can lead to difficulties actually even getting in touch with one another and filling in the gaps that we need to ensure that the child's care is appropriately coordinated and met. And we spent a lot of time discussing how different schools and different individuals really had the best of intentions and really wanted to support children and to implement their healthcare plans and so on, but often lacked some confidence. And some of the knowledge that was needed was missing through just us not being able to sort of coordinate that terribly well. And what we felt that we wanted to do was to create a gold standard approach of taking all of the guidance that was around, statutory guidance, the good clinical practice, and putting it into practice in Oxfordshire and seeing what impact that had on the care of these young people. So one of the things we started to do early on is to think about the literature and the evidence base, and thinking about schools as really core to the child's overall well-being. Obviously, this is something that I won't need to tell you, but schools are much more than education. So there's a very strong social and emotional component, so tackling bullying, promoting well-being, identifying problems, developing positive relationships and celebrating difference. And I'd be the first to admit that in my busy clinical practice as a psychologist working with children with medical conditions, I really didn't link up with schools as much as I should have in terms of, I suppose, just time and resource, but felt that I was really missing a trick, because when you consider the wide-ranging role that a school has, it does impact so significantly on a child's psychological well-being, and I felt that it was doing a disservice to the families I worked with not to do this more thoroughly. So we looked into what gets in the way. Is that sort of a problem that was unique to us? And we found that there was quite a lot of literature out there on what the barriers were to good interprofessional working. Probably this won't surprise you, but inter-stakeholder communication was top of the list. So the ability for us all to link up together and actually talk about what this young person's needs are, what the multidisciplinary plan is really, really difficult in today's climate. Often people didn't have the knowledge because that communication wasn't so joined up. So in terms of doctors and psychologists not knowing so much about the school environment and what some of the needs were, and maybe the school staff not knowing too much about the medical condition and what the impact could be, and sometimes what the child can do that maybe wasn't so apparent. Our personal beliefs and attitudes towards the medical condition can also be both a barrier and a positive factor. So there might be concerns about risk, or there might be concerns about not wanting to push a child too hard. And of course, what we need to ensure is that if we're working on an intervention, that it needs to be widely communicated to those involved in the young person's care, which doesn't often happen as thoroughly as it should. So we were sort of heartened, really, that there was a lot of information out there on the barriers to doing this well. That really formed the basis of what we did in the Medical Needs in Schools project. So this became a partnership between health and education, so Oxfordshire Hospital School and Oxford University Hospitals NHS Foundation Trust. And we really wanted to pool our expertise in psychology and education to better support this cohort of children. And what we wanted to do was to focus on school reintegration, improving outcomes across the board, and to do this through addressing some of the barriers to improve communication and joint working. So in the early days of the project, we created a 3-day training programme that roughly around 3 schools signed up for. And 30 schools signed up for, and that involved access to our training, the consultation and individual pupil support through both OHS and children's psychological medicine. One of the brilliant things about it was that the people attending got to exchange their own areas of good practice and share ideas. And we did a pre and post measure, and the results showed that the programme overwhelmingly increased schools' knowledge of the guidance and the confidence in implementing strategies to support young people. And we've really taken this learning to inform our subsequent MNIS work. I'm going to hand over to Steve to tell us a little bit more about what we've done since those early days of the project.
Thanks, Helen. So for those of you who don't know, I'm Steve Lowe. I'm current head teacher at the Oxfordshire Hospital School. So I've been here for just over 2 years now. This is the 3rd year that I'm starting off with here. And I suppose it's probably fair to say that the original launch of the MNIS project reached a threshold of engagement, and we needed to find a different way of moving things on. We found that we reached the schools who wanted to be reached almost, and the schools who were really quite positive about engaging with the challenges that young people with medical conditions were experiencing were coming on board quite quickly. They were quite cognizant of the training that we were launching. They were very active in coming and asking questions and seeking support and guidance. But as Helen said, we probably only reached in the early stages around 30 schools, and that's probably just under 10% of the schools, the maintained schools in the local authority of Oxfordshire. So we knew that we needed to move things in a different direction. We knew that we needed to do things slightly differently in order to engage more and more people. And one of the key issues there was what Helen alluded to earlier around inter-stakeholder communications. And although there's some significant statutory guidance which is enshrined in law, there's actually no regulation of the statutory guidance. So nobody's actually checking to see whether or not schools are implementing the support that is enshrined in law around the statutory guidance and supporting young people with medical conditions as fully as they should be. Thank you, Helen. And one of the key issues for us was really to look at the impact of young people with medical conditions from one end of the spectrum right the way across to the other, and to emphasise to schools in a variety of different ways, actually that all young people at some stage or another in their lives will become unwell. Some of them have acute conditions, and those acute conditions can be, really quite debilitating for them and mean that they have to have a significant amount of time absent from school. Cancer treatment, for example, will mean that young people have to be absent from school for long periods of time. Recurrent conditions like cystic fibrosis and diabetes conditions mean that children potentially could be in and out of school and in and out of hospital with recurrent support and treatment that's accessed via the hospital. And then others with low attendance that might have diabetes, which is not quite so impactful on their health, but still significant for them, migraines, epilepsy, non-diagnosed, undiagnosed seizures, for example. There are many conditions which impact on young people's attendance at school and mean that they cannot attend as fully as they might otherwise want to. And then those who are just generally healthy, but who from time to time do absent themselves from school for ill health reasons. And it's about this whole school inclusive practice that we then started to talk to schools about the cultures that they had within their school in order to support young people with medical conditions. Thank you, Helen. And then we began to start talking about how we could bring all of these partners together, because that key issue for us was very much around that stakeholder communication. So as you can see from that particular graphic there, and it really does encompass the whole concept of the logo that we've got as well for the Medical Needs in Schools project. It's bringing all of these elements together as one, and the two significant colours for us within this project are Helen's team, the Children's Psychological Medicine team, and our team at the Oxfordshire Hospital School. We've done a lot locally to bring all of these other schools and organisations together. So the enrolled schools, the maintained schools, the home schools on which young people are on their roll, CAMs, local schools nurses, specialist medical teams who support young people with specific conditions. The local authority are clearly a very significant player in all of this, and the local authority, the wider local authority inclusion teams, the SEN teams as well, are so important in those processes. We've been quite fortunate locally actually to be able to get onto the local circuit of head teacher and chair of governors briefings to be able to explain the importance of supporting young people with medical conditions on each of those briefings, and that really shifted the momentum a little bit further as well, and really opened the eyes of colleagues around the importance of the statutory guidance. We've also been working with a number of charities as well. So I'm actually a member of the Health Conditions in Schools Alliance, which is a national organisation which is made up of a number of national charities, and part of the purpose of that organisation is to lobby government around some changes that we would like to see in policy and practice. And then keeping parents on board as well, because very often parents can get quite frustrated with outcomes at one end of the spectrum, and at the other end of the spectrum they have a very clear and significant focus and a single-minded focus just on their child's health, and that can often be at the expense of worrying and caring about their education as well, and only at the point of reintegration back into school, formal schooling, do they actually then think about the impact that absence from education has had on their learning as they move forward. And the other part of the spectrum here is, of course, also GPs, and we've been doing some work around a passport as well that we are sharing between schools and medical health professionals to provide up-to-date information around the impact of a young person's medical condition. And of course, then in the centre of this, next slide please, Helen, we've got the young people themselves, and that's the really important part of all of this, that all of those people come together to make sure that as significant partners, they have a really positive impact on young people's future. Thank you, Helen. So just to finish off, two more slides here before I hand back over. We have got the benefit actually locally within Oxfordshire, both with Helen and myself and others that work closely with us. So of being part of just not local practitioner networks, but national practitioner networks as well. So a lot of the work that we've undertaken has actually been part of a wider national support network too. So we are garnering the support of others to maintain the momentum and continue to raise the spectre of young people with medical conditions and what that should mean to us. And in fact, recently, absence of education for all young people for a short period of time following the COVID crisis and lockdowns and more local lockdowns that many areas across the country are experiencing at the moment has really raised the profile of the impact of the absence of education from children and young people. But actually what's important to us is the fact, and what we must continue to remember, is that young people with medical conditions have significant periods of absence from their education all the time. It's not just COVID related. COVID will go, yes, it will take time, but it will go. But young people will always have periods of absence from school because of a medical condition. And it's important that we make sure that people remember this. So we are part of national networks where we are looking to lobby government and Department for Education for changes in some policy and practice to make sure that there is a regulation around the way in which the statutory guidance is deployed by local authorities and by schools themselves, to help to raise that level of information around what it means to be a young person with a medical condition in school. One of the other things that we've been doing more locally as well, because many of you will be aware, having I'm sure read the statutory guidance, that every school must have a named person within that school who takes responsibility for young people with medical conditions. Sometimes it can be the SENCO, often it can be the SENCO within schools. So we've actually started working with our local SENCO training provider, which is Oxford Brookes University, and we have a slot within that SENCO training network to be able to train the SENCOs around the importance of supporting young people with medical conditions. It's not always the SENCO, but can often be, and that they often have a very influential and quite important role within schools. We're also beginning to work with teacher training providers as well to ensure that colleagues who are just entering the profession have an understanding and a greater awareness of the impact of medical conditions on young people. Thank you, Helen. So what we're looking to do really longer term, sorry, there are a few clicks here, Helen, forgive me as I go through, thank you. What we're really looking to do is to change people's attitudes within schools so that the work to support young people with medical conditions becomes a habit, it becomes routine within schools. And we're looking to do this ourselves by the three things on the left-hand side of this slide now. So we are looking at training. We've got lots of training courses that are available, and some of those are going to be for you in Suffolk, going to be explained to you today. We're looking at supporting colleagues with policies. So we've got our own exemplar policies that we're supporting schools with, and we will also support them to write their own locally nuanced policies if it's appropriate to do so. And we're also, through some self-assessment materials, providing with an opportunity to make sure that they've got their own accountability systems in process and in place. What there aren't at the moment are those national accountability frameworks, as I spoke of before, but certainly schools should be looking at how they can hold themselves account to support young people with medical conditions. So this becomes what we do every day within our own settings. It's what we say. It's making sure that our language is supportive of young people with medical conditions, of the whole school, so that there is an inclusive approach and atmosphere and attitude. And it's so that we're aspirational for young people, for all young people. It's about equality, but to begin with, it has to be about equity. It has to be about giving young people who have had long periods of absence from school, giving them a leg up so that they don't miss out. Thank you, Helen.
Okay, so I'm just going to attempt to get my screen off screen sharing. That should have done it.
Thank you, Helen. Thank you, Steve. We're going to go next to Kate Kingsford, who's the lead teacher at Ipswich Hospital School, and she'll be giving an introduction on the self-assessment.
Hello, everyone. Welcome. I'm probably going to talk without my video on because I'm not really sure if my internet connection here at the hospital is that great. We'll see how we go. I'm just going to try and share my screen. I hope you can all see that. Please let me know if you can't. Okay, we're ready to go. So welcome and thank you all for taking the time to join us today. As a teacher working at Ipswich Hospital, I can see all too often the impact that a medical condition can have on a child and the detriment it can place on a child's progress and well-being, both physically and mentally, of course. And the fact that you've taken time to join us today is a great step forward in raising awareness for this group of disadvantaged pupils. So firstly, can I say thank you very much for being here? Some of you might be listening and thinking, we don't have any pupils with medical needs in our schools. You may not currently, but I think this is unlikely. And we're not just talking about nut allergies here, but all medical conditions, which of course include children's mental health, as well as very serious life-limiting illnesses. From my experience, schools often feel out of depth when asked to support a child with medical needs. So we are here to work in partnership with you to support you in supporting your cohort of children. So before we go much further, it's good to know the benefits for your school by joining this project. So what's in it for you? compliance by signing up to Medical Needs in Suffolk, we will support you with this process, ensuring that you are complying with the DfE statutory guidelines. We will visit you in school, looking at your self-assessment and creating an action plan for areas that may fall short. The access to toolkits, you will have access to a variety of toolkits that will explain medical conditions in layman's terms. These kits also have practical ideas to help support pupils with various conditions. I've put as an example here on the slide, anxiety, chronic fatigue syndrome, because these are currently what I'm being asked about quite a lot by our partner schools. Moving on to training, we've put together a programme of training workshops where schools can drop in via Teams and speak directly to the experts, for example, clinical psychologists, specialist practitioners in their field. We have workshops on chronic fatigue, self-harm, managing pain, anxiety, diabetes, gender dysphoria, eating disorders, as a few examples. This is where you will be able to find out more about the illness, learn about how best you can support, and crucially be able to ask questions directly to those who manage these conditions on a daily basis. Workshops will be about 30 to 40 minutes max. We are busy, we know that. So these are not designed to be arduous and time-consuming workshops, just useful and informative. Alongside the drop-ins in workshops, we of course will provide you with your mental health training. By 2020, it was the government's aim to have at least one mental health first aider trained in every school in England. I wonder how many of you today have at least one in your school. Our Mental Health England accredited trainers will train one member of your staff for free on our 2-day training course. And we will also offer a further 15 staff the half-day raising awareness training that can be split over 2 online sessions or delivered face-to-face at your convenience, and of course when COVID allows. The more staff aware of how to spot potential mental health conditions, the earlier we can intervene to potentially avoid a crisis. Resources. Each school will receive the Supporting Medical Needs Manual. This is a nice glossy book that will give you further information on common illnesses, medical conditions in schools. It gives definitions, causes, treatments, and crucially for you, the educational impact of these illnesses. The access to toolkits we've already mentioned, but also you will have access to a medical needs in schools rep when you need them, and medical needs in schools support and the self-evaluation app that we will talk about later. Local and national partnership. We're already linked closely with our colleagues in Oxfordshire, as you can see today, but through the National Association of Hospital Education, we link with other hospital schools around the country, linking also with health professionals and others to share good practice and expertise. As our partner schools, you too will benefit from this collaboration and sharing of their expertise. I want to move on briefly to share with you the 5-stage process of the project, of the Medical Needs in Schools project. So at stage 1 is identification. So you sign up to take part by emailing Laura, and the details will be given at the end. Stage 2, you carry out a self-evaluation using the app that we'll talk about later, or by a paper-based audit. Stage 3, a Medical Needs in School rep will visit you at school to go through your self-evaluation. And stage 4, from this, a report will be generated with agreed actions. And stage 5, I know it says 6, but it's stage 5, you may agree a follow-up visit, further support and training as a result of your actions, and potentially a review of progress. I'm just going to go back to stage 2 and look at this in a little more detail, the self-evaluation process and what this means for you as a school. I think essentially, and probably perhaps what you're thinking is, how much I want to be involved, but how much work will this be? So I think it's important to share. There are 4 standards against which you will self-assess. Each standard has a variety of strands within them. So standard number 1 looks specifically at your policy, ensuring that you have a medical needs policy in your school and that it meets, crucially, the basic statutory Department of Education requirements. For example, it needs to be reviewed annually. You have to have a named person, as Steve was referring to earlier, who has overall responsibility for the implementation of the policy. It takes into account staff training needs, and it covers the role of IHPs, which moves me on to Standard 2. Standard 2 is all about individual healthcare plans, and it looks in a very detailed way at these. If you don't know what one of these is, please don't panic. We will support you, and we will be offering a full training session on this. But it is a statutory document that all children should have if they have a medical need, physical and or mental, and schools are responsible for putting them in place. But as I say, please don't panic. If you don't know what one of these is, there is a support training package and a workshop coming up very soon on this standard. Standard 3 will look at the roles and responsibilities. This standard looks at the role of the governing body in particular and head teachers, ensuring that pupils with medical conditions are supported to enable the fullest participation possible in all aspects of school life. Standard 4 is the equality of access. This strand is the standard that looks at inclusion, the importance of risk assessing, reasonable adjustments that we're asked to make, participation in school visits, trips, etc. Schools, for example, should make arrangements for the inclusions of pupils in all activities with any reasonable adjustments as required, unless there is evidence from a clinician, such as a GP, that states this is not possible. Finally, Standard 5 is the promotion of attendance. Every child has the right to a full-time education offer. Part-time timetables are implemented only as a part of a planned reintegration into school, and they shouldn't really last longer than a half term. This strand, or this standard, looks at the process involved in implementing the part-time timetable for pupils. So this was very much a brief overview of the self-assessment process for the project. To make it simple for all of us, our Oxfordshire colleagues have created an app that you will have access to if you wish to support you through the process. We know if it's not simple, you might not use it. Believe me, I can use it. So it's a wonderful tool that you have created, and I'm going to pass over to Steve now, who's going to tell us a little bit more about it.
Thank you, Kate. I've got a brief presentation just to show you on this, just to help you with it. So just let me get this set up for you. I'm hoping that you can now see my screen with a medical needs self-evaluation review tool. Okay, so very briefly, one of the reasons for doing this was that we found when we were doing this self-evaluation with colleagues within Oxfordshire that the format that we had was not particularly engaging. Staff were finding that it's just another self-evaluation to undertake, and as professionals, we often find that we're doing lots of reflective work. So we wanted to make something that was going to be accessible for colleagues. We also felt that because we've got 370 odd schools, maintained schools within Oxfordshire, we wanted as a hospital school to be able to have an overview of what the challenges were locally, so that we could really target our training and have a very clear understanding of what was going on within each of those schools. We had our thoughts, we had our views, but clearly we didn't know unless we had that information in front of us. So to have an overview of what that self-evaluation was looking like was going to be important for us. And let's be very clear, it's not about anybody making judgments as to the quality of provision within schools for young people with medical conditions. That's not what this is about. This is about school improvement. It's about improving opportunities for young people with medical conditions. It's about improving education chances for them. So Kate talked about compliance, and that's what this self-evaluation tool is all about. It's about providing a level of compliance for them. It's about looking, as Kate said, about those 5 specific strands to ensure that young people with medical conditions are supported as well as they possibly can be. I'm going to move forward fairly quickly because Kate's already covered some of this stuff for you. So the app is very easily downloaded from the iTunes App Store or Google Play Store in much the same way as you would do any other app that you'd download onto your mobile device. It comes not only as a mobile device app, you can also use it as a desktop application as well, so you can do it on your laptop as easily as you might do on your phone or your tablet device. It's really easy to use, and the first time that you get through it, it's a case very much of just making some really straightforward decisions about where you feel your practice currently is at. Let me show you what it looks like. So once you've downloaded the app, it looks like this. You download it, you log in, and it looks like this. So this is the home screen on your device. So you've got 5 of those tabs, and then you can just of it if you so choose to do so. I'm just going to take you through a couple of those buttons at the top there. So the first button at the top there just gives a bit of information about the local organisation. This one's all set up for the Oxfordshire Partnership, so there clearly be some information about what it looks like within Suffolk when it is launched with you guys. There's some information about what the project actually does more locally as well, so there's a bit of an understanding for schools so that you can see what the details are for you. The second section is where it goes into the details, so you can start your assessment and then it goes into each of those 5 standards, and those standards, as you can see on the middle screen there, are then broken down into separate elements. So standard 1, the policy element, you would evaluate your current school performance based on your policy. Is it reviewed annually? Do you need support on that? Is it in place, or is that particularly strong? Strong in respect to the fact that you're not just paying lip service to it. You're actually it. You do something with your policy that reviews the young people's conditions that you have within your school and making sure that practice reflects policy as well. So there's a number of elements within the first standard, and similarly within all of the other standards. I won't go through the whole of it for you. It's for another launch event at another time for you. On the top right-hand side of the centre page there, you can see the word guidance. The guidance button takes you through to some information that will help you to improve your practice within each of those standards and the elements that sit within those standards as well. So all of those guidance buttons will take you through to other links, sometimes websites, sometimes guidance documents that will help you to improve your school's practice. So it's not only a self-evaluation tool, as I said before, it's about school improvement. This is not about judgments, and nobody is saying that because a school might evaluate themselves as requiring support, that they're not doing a good job as a school in terms of their inclusive practice. So there's also an app provider dashboard. Now this is really quite a magical part of the application actually. So this sits on our, as Oxfordshire Hospital Schools network, so we can see this, and the Radbold Trust would obviously have sight of theirs for Suffolk. And what this does, it gives us an opportunity to have an overview of where all of the schools are. So you can see there that you've got different coloured buttons on the right hand side of that dashboard, the screenshot of the dashboard under standard 1, 2, 3, 4 and 5. And the first school there, you can on the left hand side underneath the school column is just simply called Sample Academy. And within Sample Academy, you can see under standard 1 that they have evaluated themselves for 3 of those elements within standard 1 as needing support. So that gives Radbold Trust or Oxfordshire Hospital School a really clear idea and understanding of where the support and guidance needs to be targeted for schools across the county. It gives an opportunity for them to go in and provide either specific, localised or county-wide support at every level across each of those standards and with each of those elements within those standards. That's a very brief overview of what it looks like. I mean, I have to just reiterate what Kate said there. It's a very easy to use application. It's something that apps are very, very useful to use. And it's something that we're really keen to develop further. We will be moving the app forward. There will be more developments for the app, and if anybody wants they're a user on the site, has any suggestions about how it can improve, we will certainly update it and upgrade it as we move forward. Thank you, Kate.
Okay, I think it's over to Jamie. Sorry, Laura.
Yeah, over to Jamie Benson, head teacher at Parkside Academy, which is part of the Radbold Trust.
I'm hoping that people can see my screen now. There we go. Okay, thank you very much, guys, for again being here this afternoon. So I suppose what I'm going to be talking about is the Robots in Schools project as part of medical needs in schools. So I suppose the use of robots in schools has become all the more pertinent given COVID and everybody's focus and review of how we're going to provide remote learning for students in the event of any lockdown in relation to COVID. But prior to that, our starting point was for those students that we've been talking about who have complex medical needs, who haven't been accessing education perhaps for a long time because of that condition, how we can engage them not just in their education, but their social and emotional needs as well. Because it's one thing being out of school and not having access to the academic education, but the potential loss of friendships and regression perhaps with social and emotional needs. And we identified that as an area to look at. So Robots in Schools essentially is a funded project that we have from the Wilson Foundation, who've allowed us to purchase a couple of different types of robots that we'll speak about shortly, and the associated technology for that to be issued to students with the medical needs who aren't able to physically attend site to access education as a result of those needs. So the performance indicators that we've looked at for that project is making sure that students, regardless of the medical needs that they have, are able to access education, not just in its minimal form, but to receive a good education. To make sure that although they are physically not there, their social and emotional needs are able to continue to be met. And looking at the work that the Oxfordshire Hospital School and their robots programme have already undertaken at the point, one for support, but to make sure that we have that network in order to make the project as successful as it can be. So in terms of where we've started from, so Medical Needs in Suffolk has evolved from the Medical Needs in Schools Oxfordshire programme. At the moment, we're in the position where we have purchased 2 AV1 robots and 2 iPads that can be used by 2 students. We've purchased 2 3 robots and the iPads required for that. And they are now in the process of being distributed to students who've been identified through inpatient care at Ipswich Hospital School to allow their education to continue when there are prolonged absences expected from school as a result of those medical conditions.
Jamie, sorry to interrupt you.
Yeah.
We can only see the first page of your presentation.
Ooh.
It's not running through the slideshow.
Thank you, Laura. Let me try that again. Can you see that?
That's better. We can see
Yeah.
it now. Thank you.
Yeah. So in terms of current research then, although we've only been, I suppose technology's been more at the forefront in the past few months, this isn't something new. Using robotics in education and telepresence devices in education, going back as far as 2002, what research was finding was that where there was a telepresence device in place of the student in the classroom, that there was minimal impact of that absence, that student sitting at home who was unable to access school as a result of medical condition was able to access the education just as well through a telepresence device rather than being on site. As the use of robots in schools became more and telepresence devices became more common, and there was more study done in relation to student absence, what research was shown at that point and continues to show is that where students are absent from school and where that social breakdown happens as a result of the absence, there is a clear relationship between loneliness and depression for that. And then from 2017 kind of onwards, where again telepresence devices were becoming more common, that the use of those devices, one, it reduces social isolation because the robots, the telepresence devices are able to be taken around the school, not just in the one classroom, they're able to be transported around the school. So they were able to speak to friends at break times, lunch times, transitions in the corridors, which we all know can be a challenge in its own way sometimes. But also it had a positive impact on the educational attainment of the student who was absent. Can I just double check, Laura, can you see the new slide?
Yes, we can see it.
Excellent. So the two robots that I've been referring to, so we've got an AV1 robot, telepresence device rather, and we've got the 3 telepresence device. The main difference between those two devices is that the AV1 has no screen. So when the device is in the classroom, you won't be able to see the student at home, but the student will be able to see and hear what is in the classroom and be able to talk to their peer sitting next to them or the class teacher. The 3 robot, I suppose in its simplest format, it's an iPad on wheels, and it can fully transition around the school as the student would normally be expected to do. Obviously, there are some problems there with stairs, but considering that the student would be able to access all other aspects of their education, that's quite a significant improvement of where it would be before. So the telepresence devices, like I've said, there are 4 that have been purchased by the Radwell Trust through funding from the Wilson Foundation. They will generally be provided through the Ipswich Hospital School, where we have where they've been identified as being an inpatient for an extended period of time. If you have a student who you believe maybe where a telepresence device may be appropriate for them, please just get in touch. There's absolutely no reason why we wouldn't be able to talk you through potential support that we can do with that. Where a device has been deemed appropriate for a student, you will be supported in ensuring that the devices are able to work correctly for the student, for the family, and I suppose ultimately within the school network. The devices are all Wi-Fi enabled as well as mobile data enabled. So where Wi-Fi could become an issue, there is that mobile connection there as a backup. In terms of training, it is a very straightforward device to use. Both telepresence devices work from an app on an iPad. The iPad is given to the student. Essentially, one of the main areas that we need to remember is just make sure it's plugged in and it's charging. In terms of safeguarding and who can see the data, who've used the data, screenshotting, both of the devices are currently compliant with GDPR. They both use secure encryption. Neither of them should be able to take screenshots. That's prevented through the app. In the agreements that are issued at the point of delivery, it should only be used by the student. There shouldn't be anybody else. No parents sneaking observations of lessons or learning or anything like that. It should only be used by the student. And at the point, all those terms are shared clearly with family, clinicians, and education, where there is the initial meeting that takes place. So in terms of where we're going to next with the project, so there are the 3 robots that will be issued in the next couple of weeks to identified students, one of whom there is a lovely article in the Mirror today about one of the students who'll be accessing one of the robots. So that will give a bit more detail, should you wish to have a look at that. And then if you have identified potential students who you feel would benefit from having access to a telepresence device, like I said, please do just get in touch, and we will be able to support you through that process. I am incredibly sorry for the PowerPoint slides at the start, but I will now hand you back to Laura. Thank you very much.
Thank you, Jamie. We can also share the slides out on our website. We're going to go next to Helen, who is going to speak to us about supporting children with medical needs in schools.
Thanks, everyone. So I've got a presentation which forms sorry, something's just popping up on my screen, which forms part of the training programme that we started in Oxfordshire, and I've adapted it a little bit for today's session. I'm aware that we're probably a little bit over time, so I'm going to focus on the key points, but you will have a copy of the slides, as Laura says. So I'm going to spend a bit of time thinking about supporting children with medical needs in schools, to consider the links between medical, psychological and education outcomes, think about the impact of having a medical need on education, and to discuss the barriers to supporting children with medical needs. Then to think about what we know works based on the evidence, the literature, but also our learning through MNIS Oxfordshire, and to think about how we can take it forward with MNIS Suffolk. In terms of the interface between medical needs, psychological well-being and education, we know that there are many reciprocal relationships. And I'd invite you to spend a bit of time maybe thinking about what you know some of the relationships to be. And I'm sure that many of the pupils that you work with will have demonstrated an impact on their education from their physical health, and possibly some mental health needs that have arisen from the challenges associated with that. And it's really difficult to separate out these 3 entities, physical health, mental health and education, as distinct. As you can see from the examples here, there are significant impacts across all 3 domains that arise through missing lessons, having persistent physical symptoms and looking different, as just 3 different examples of what children with medical conditions and medical needs might experience. As you can see, and I'm sure you'll have experienced yourself, there's lots of feeling of playing catch up, lower achievement, fewer social experiences, feeling different, and then the knock-on effects on the physical aspects of life for a young person. So sleep, cognitive functioning, physical activity, attention, concentration can all be impacted on. And then more the psychological side of things, so answering questions for others, feeling stared at, feeling different, and in some cases, mental health needs. Add into the mix all of these other things that we know affect young people, so adverse childhood experiences, trauma, attachment needs, behavioural presentations and neurodevelopmental issues, and we really are looking at a very complex picture for some of these young people. And coming back to what Kate was saying earlier, it might seem that we don't have many children in our environment with physical health needs or medical needs, but actually when you break it down, it's quite a prevalent issue. So when we talk about medical needs, we are thinking about mental health needs too, and we are thinking about the various factors that will influence a young person's well-being and the impact that that has on education. So when we look at the known statistics about some of these difficulties, hopefully this slide illustrates that it's very likely indeed that you will have a young person in your environment who has a need associated with psychological or physical well-being that we will need to consider in order to optimise their educational experience. So what do we know about the interactions between physical and mental health? Well, we know that psychological adaptation isn't predicted solely by severity of the illness. So that means we might perceive that a young person will be struggling. Perhaps they have a life-threatening condition such as cancer, and we might assume, therefore, that they're going to have psychological difficulty. But we know that that's not the case, and there are many other factors that impact on psychological adjustment to a condition. And in fact, many young people are incredibly resilient and will have good psychological health even when they have a very severe objectively condition. We know that young people with possibly objectively less significant or severe health issues might have a greater psychological need associated with them. And we know that a number of things such as perhaps living in poverty, parental mental health, lots of other factors will be a mediator in terms of how a young person will cope with these additional challenges posed by their medical condition. As I've outlined, we know there's a reciprocal and inseparable relationship between mental and physical health. So thinking about one without the other will be detrimental to providing a holistic care plan for that child. And when we're thinking about an individual healthcare plan, we really need to be incorporating both physical and mental health considerations. We should bear in mind there's a huge mental health agenda at the moment. There has been for a few years, and rightly so. But children with medical conditions are usually about 4 times more likely to experience mental health difficulties, and this can even be higher for some conditions such as epilepsy. So really this is a double whammy of risk to this population, and these children really need our support. And the reason why it's so important is that we know that if children have psychological difficulty in childhood, then they might have poorer long-term physical and mental health outcomes in adulthood. So really getting it right early on is critical. And hopefully you'll sign up to be part of the project ongoing, and at one of the training we'll probably do this quiz in a little bit more detail. But I like to sort of open a discussion about these statements at the bottom, and to have some thoughts on, are they true or false? And one of the things it's helpful to reflect on is perhaps the different views that a child, a parent, teacher, doctor, or psychologist might have on these different issues affecting young people with medical needs. I'll leave that for you to have a think about, and these slides will go around so you can read through them more thoroughly. So let's think briefly about the impact of medical needs in the education setting. And I wanted to start by reflecting on what the normative developmental tasks of childhood and adolescence are. Focusing particularly on adolescence, we know that it's a time of great change cognitively for young people. And with that cognitive change comes the ability to think about things in a much more sophisticated manner. And our peer group becomes much more influential, and our family relationships become less pertinent to us. We often in adolescence don't have the long-standing networks that adults have, and it's a really critical time for psychological adjustment and adaptation. Part of the process is finding out who you are, so thinking about your moral standpoint, your goals, your dreams, what you stand for, what your values are. And we know that in this time period there are critical milestones and transitions that have to be achieved. And if they don't, then we run the risk of a child's psychological well-being being impacted on. So hopefully you can see and think about how having a medical need will interact with almost all of these developmental tasks of childhood and adolescence. And because of that, getting the support right during this time period is really critical if we're going to support children with these additional needs to manage this period successfully. Just put in brackets here at the bottom, add in the pandemic impact, because of course the pandemic will have been a double whammy on this. So at a time where these children are already at greater risk of mental health difficulties, of social isolation, we've got the pandemic come along and intensify the impact of some of those things. So looking at the literature, what does the research say about the impact of having a medical condition in school, and how does that relate to those normative tasks of adolescence? So we know that the huge impact that young people tell us about is on the social side of things. So having a medical condition will interrupt social conformity, so feeling different, being different, having to explain why you weren't in that lesson and so on, is a really big issue for young people with medical needs. And obviously, to them, the social side of things might be the most pertinent, but for us in education, we might be thinking about the disruption to their education and their educational attainment. Many studies highlight social isolation as being the biggest factor, and as we'll see a little bit later on, that's a real predictor for developing depression and associated symptoms. So tackling social isolation should be high on our agenda in schools for this group of young people. Forming and maintaining social connections is hugely important, and Jamie talked about the robot and obviously its importance in terms of a child's presence within the classroom, and that can be really critical in terms of social connections. So using the robot at break times and lunch times is going to be really meaningful for our young people who are unable to be physically present in school as much as during lesson time. Study after study highlights lower academic attainment for children with medical needs, impacted on by any number of factors. And what is really striking is the study by Case in 2005, which even when the researchers controlled for factors like socioeconomic status, having a medical need had an impact on the attainment of young adults and going into adulthood. So they had lower paid jobs, for example, simply mediated by the fact that they had a health condition in their childhood. So there's a massive impact here of having a medical need on the whole education of a child. If we add in the pandemic, we know that this is a group already at risk of mental health difficulties, 4 times as likely to develop a mental health difficulty than their healthy peers. It's a group already exposed to difficult circumstances and multiple demands. So I don't know what your hospitals are like, but if you come to park at the John Radcliffe, you can be queuing for an hour, you have to sit in that, there's the stress associated with that, there's the procedures, there's the difficult news, there's the change to your life and all of the different regimens you have to follow. And now add in the restraints of the pandemic, and of course some young people will have been shielding and really exacerbating the potential for social isolation. We know that young people with health conditions have told us that what is really important to them is social isolation and a feeling of not being connected to others. And we know that the pandemic will have just highlighted that even further through the restrictions. And we know that this group already is at risk of lower educational achievement. Thinking about the known impacts of the pandemic generally and how they might impact further on our young people with medical needs, we know from a rapid review of the literature that was conducted by Lords et al. At Bath University earlier this year, that the factors associated with quarantine put children at greater risk of psychological difficulty, and the impact of that has been shown to extend up to 9 years later in some research studies. We know that social connectivity and social isolation is linked to depression, so getting it right for our young people to feel more connected is really important. But what this study highlighted is that it's not simply sufficient to increase the amount of time that a young person spends in the company of others. It has to be meaningful activity, so it can't be tokenistic. And that's really important in terms of how we develop a protective strategy towards our young people's mental health. Just building on the risk factors here, we know that children who have gone through quarantine are up to 5 times more likely to utilise child mental health services, and that's healthy children as well. So when we think about our young people who are already vulnerable to having mental health needs, that's really a significant increase in their risk. Some of you might have heard of the course-based study run by the Emerging Minds group through Oxford University and partners, and they are starting to publish quite extensive data on parental and child reporting of the pandemic. And we know that younger children are being reported as increased in their levels of distress. Interestingly, teenagers less so, presumably because of the reduced demands during the lockdown period, but we're all expecting, and indeed might have already seen, increased distress in young people who have mental health needs and physical health needs too. So we have to think about what is the extended problems that might be associated with the lockdown period on our young people. So hopefully I've made a strong case for why this is really important to think about from a holistic manner, and with joining up services and professional groups to get it right for these young people. But we know from the literature there's lots of barriers that might make this tricky. This is some of the things that I've heard our doctors and indeed myself ask of schools to support a young person with a medical condition. So reduced timetables, keeping them off the playground, feeling different and managing how other people ask questions about child looking different, finding a quiet room, talking to the rest of the class. There's so many demands that as a system we put on schools to help manage the needs of a child with a medical condition. And under the hugely reduced resources that many of us are operating under, it can be a real challenge to meet the needs of young people in school. So in terms of the barriers, we're faced with those resource issues of having to implement often quite stringent rules about a child, but also the research tells us that there are many other barriers that can get in the way too. So young people themselves might be really wary about telling their education team about the illness and the impact of the illness for any number of reasons, and this can lead to difficulty putting in place appropriate supports because we simply don't know what the needs are. Thinking about knowledge and attitudes. So sometimes teachers certainly tell me that they feel that they don't get enough information from the hospital system about the condition and about the impact on school life. And this is certainly borne out in the research that's being conducted. This can lead to some unnecessary restrictions being put in place and a misunderstanding about some of the child's needs. And it can also reinforce the child feeling different because somebody knows about their illness, and attitudes and criteria can be different to this child. Even things like giving them more leeway to complete homework and that being sort of mentioned in class can increase that sense of difference. We know that some teachers have knowledge about the medical conditions, but in this study, very few teachers said they have a high level of knowledge or a high level of confidence. And one of the great things about the Medical Needs in Schools project is that teachers told us that they felt the training that we provided increased their knowledge and confidence in working with this group of children. Sometimes teachers highlighted surprise or concern with relation to young people pursuing education vigorously when they have a serious illness, and there were some worries about overloading the young person or not wanting to feel like they were talking about education when the child is going through significant treatment and not overburdening. So wanting some support with how to manage that, which they didn't feel that they had the pathways to get those answers. And finally, consistency. So we know that within a school, within a busy environment, even within the same school, there can be differences in the way that interventions are managed, the amount of information different staff members have about a young person, and really getting that consistency in the school environment can be quite a challenge. So addressing these barriers is really something we've tried to do through our support on the MNIS project, so that hopefully we can help to troubleshoot the particular needs of different schools and different children that they're supporting. So how do we think about getting it right? So that's the literature pertaining to what the barriers are, but there's also been quite a lot of research looking at how we can provide an inclusive culture. And Steve talked a lot about changing the culture in which we work, and I think that really is key to ensuring that pupils are best supported. So we know that relationships within the school environment, both with peers and staff, is really important, reducing that sense of social isolation, increasing the sense of connectivity. Thinking about how the child learns, so making sense of and constructing their knowledge, either through in-class learning or at-home learning. An individualised programme for that young person that really takes into account their needs. Seeing students as individuals and not diagnoses. So again, Steve talked about the language. So sometimes we can, and certainly in the hospital, we can talk about cases, for example, or we can talk about the child who has such and such, and moving towards a different language around the children that we're supporting, really involving parents and the child. Thinking about individual beliefs, knowledge and attitudes, addressing misconceptions, making sure that we all feel accountable for supporting the young person. That comes back to the statutory guidance and seeing it as everybody's responsibility, and providing correct training that is going to help people understand the impact of a certain medical condition on a young person, what some of the challenges that child might face and some of the ways of overcoming them. Thinking about transition, so hospital to school transition, times where there's been periods off school, transition between year groups, between new challenges for the child, whether it's a new subject and so on, being mindful of reintegration plans, developing strong working relationships with school and healthcare systems, and ensuring that the school has all the information it needs to best support the young person. And using technologies has been highlighted in a number of studies, and obviously we've seen huge advances of that recently during the pandemic. Certainly lots of young people are telling me how helpful it is, and young people I know that have really struggled to access face-to-face education through their medical needs have hugely benefited through the online ways of working. And I've gathered up some of the themes here from my learning throughout the MNIS project and from what young people have told me. And these are really the voices of the young people here. So what they tell me is really important to them is being held in mind when not physically present, so by staff and pupils. So things like pupils sending a card to them, doing a Zoom call from class either at lunchtime or during a lesson, and staff knowing who they are when they come back into class. Which might sound a bit daft. Of course, staff would know who they are, but some young people say, you know, I went to this lesson, I hadn't been for a while, and they didn't recognise me. So just having to explain to people who they are is really difficult. So that sense of, you know, people care about me, people know who I am. Feeling that someone's given them feedback on the work. So lots of young people say, you know, it makes such a difference when they submit a piece of work that they've done at home and they get an email or they get a comment on it from staff when they're back in the school environment to show that it is being looked at and their efforts have been acknowledged. A young person said to me just this week, actually, and I thought it was such a powerful thing. He said, you know, often the school's focused on my attendance. How can they get me in more? And I don't feel like I can get in more. I'm too tired. I'm in too much pain. But what I really want to do is to make sure that when I am in and when I'm doing the work at home, I actually understand it. So how can we move the focus from simply attendance to how can we consolidate the learning, and how can we ensure that we're making sure the child is getting as much as they can from what they are able to do. Having that consistent link person, so having a named person that you can check in with, that you can say how things have been going, rather than multiple different people. Regular holistic reviews. So parents often say that they can feel like messengers between the child's medical team, their psychology team and school, but getting as many people around the table as possible to regularly review the individual healthcare plan or equivalent if you don't yet have one of those. And of course, with the pandemic, that's made life so much easier because we can now do it via remote means as we are today. Seeing school as a socialisation opportunity if a young person isn't able to attend lessons for whatever reason, making sure that we bring young people in for break times and for less structured lessons where there's opportunity just to see their friends and have that meaningful interaction that is so important to them. And one of the things that young people have really said to me since the pandemic is they're so thrilled with the amount of digital platforms that are now available to them. And I know lots of young people are really worried that with the return to face-to-face teaching, that will get lost. So some of the programs that they've been able to use has been so helpful with filling in gaps and so on. And they're seeing less and less of that now as face-to-face teaching returns. And young people are really keen for that to continue. So why is it important that we get this right? We know that if we work together as a multidisciplinary team, and of course with the family and child at the heart of it, we can reduce the physical effects of the condition. We can reduce absenteeism, and we know that if young people are in school, we are much better able to identify any safeguarding concerns. We increase their social and emotional development, and that is so critical to their journey into adulthood and their psychological well-being. We increase participation in school life. We lower the risk of associated psychological difficulty because we're increasing social connectivity and reducing social isolation. We're increasing their educational achievement, so trying to turn around those stats that having a medical need is much more likely to see you have lower educational attainment, and overall help our young people to reach their full potential, which is what we all want. So in terms of the next steps, thinking about what have we learned from MNIS Oxfordshire and how can we support MNIS Suffolk? Hopefully we've learned a lot through the project. We've learned a lot for what works best in terms of dissemination of the training packages and the consultation. And hopefully we've done a lot of work on the literature and the research of what helps us to get it right. So we hope that, thinking back to those barriers that I outlined in the initial talk today, we hope we can increase the knowledge base and increase confidence in implementing strategies so that we're really tackling some of those barriers to good holistic care across the professionals working with a child. We hope that the programme will allow us to share examples of good practice with each other. There will be so many examples within Suffolk, just as there are in Oxfordshire, that we can talk to each other about and implement in our own environment. And hopefully with the support of the MNIS team ongoing, as has been outlined, we can support the holistic better outcomes for children with medical needs. So that's a really quick whip through, and hopefully I haven't talked too long, Laura. I've kept us to time. I will send the slides through because I know there was a lot of detail on them, but I will finish up there and take my screen off sharing and hand back to you, Laura.
Fantastic. Thank you, Helen. We're now going to just wrap up with Kate Kingsford, who's just going to explain next steps and talk about some of the workshops and how you can get signed up.
Thank you, Laura. I hope you can all hear me. Got a lot of feedback.
We can hear you quite clearly, Kate.
You can hear me, can you? Wonderful. Okay, so I'm just going to share my slide with you, my final slide. And it's next steps for medical needs in schools Suffolk. So what do you do if you would like to join us in the medical needs in schools project? And we really hope that that you will. Please confirm by email that you wish to become one of our partner schools. To do this, you'll need to send your medical needs in schools contact. This is going to be the person who you choose as your medical needs in schools lead. And we ask you to do this by Friday, the 16th of October, please. The email is on the slide, and it's the one that you have been using to express your interest anyway, so you already have that. Once you've signed up, we will send you your self-evaluation. It's not an onerous task. You can use the app to support you if you wish to. And you can also join us on our first workshop. And I strongly suggest that you attend this. We will record it and send it out to you if you're unable to attend, but it's on the 20th of October. And it's all going to be on statutory guidance and individual healthcare plans. So that's a really good starting point for us, I think, to cover. For more information about medical needs in schools in Suffolk, there is a link that will be emailed to you on all the workshop training that I referred to earlier in the presentation today. Please do have a look at the Radworld Trust website, the outreach services, where we have a dedicated medical needs in school in Suffolk, medical needs in schools Suffolk page. And this link, I believe, has already been emailed to you. If not, it will be. So I just think I ought to share as I've got the newspaper right here, what can be achieved when we work together. And this is in the Daily Mail. I know that Jamie referred to it already, but it's on page 21 in the Daily Mirror today. One of our students attends Copperston, year 9 pupil, and he is one of our patients at Ipswich Hospital, has attended Ipswich Hospital School and hasn't attended school for a year, was feeling isolated. So we were able to support Alan in getting a robot, and you can read about him page 21 today in the newspaper. So I wanted to share that with you as a real example of what's happening, and it's just happened in the last couple of weeks. This is what happens when we work together. So once again, thank you to everyone for attending today, and please do email any concerns or questions. As I said, a recording of today's launch will be sent to you in case that you've joined us late or that you've been unable to fully join us at all today. A big thank you to Helen and Steve from Oxford Medical Needs in Schools Oxon. We are very grateful for your support, and to all our Suffolk schools and partners, thank you very much for joining us today, and we really do look forward to working with you in the future. So many thanks, everybody. Dora, I'm handing back to you. Unless there's anything else, I think we can say goodbye.
I think we can say goodbye. Thank you for joining us, everybody.